My name is Kathy Adams, and I'm the nurse navigator for the Heartburn and Reflux Center of Richmond. My background consists of approximately 15 years of case management experience. After that, I went back to nursing school, and I did about 1 year of medical surgical experience, and then I worked in endoscopy, which gave me a lot of good background to do this job. It's case management and endoscopy, so I was pretty familiar with everything required of the position. At the center, we see a wide variety of patients. A significant number of patients have heartburn and reflux. We have patients that come to us with swallowing issues, some with some digestive issues. A lot of patients really aren't sure of what's going on. They just know it's some type of maybe esophageal or stomach issues, so they come to us looking for answers. My role as a nurse navigator is to help patients navigate their way through our program. That consists of me talking to the patient, getting some background information. I do an intake form with the patients. I help gather medical records for the patients so that when our physicians see them, they have a good understanding of any testing our patients have already gone through. So our program is definitely very unique in what we can offer. It's been a great experience for me. It's a need that hasn't really been addressed prior to our center opening, and I think it's an exciting prospect for patients. The patients that have come to us have been so excited that we listen to their issues. We're not just another physician's office throwing pills at the patients. We can really give them answers, options, and hopefully relief for their symptoms. So when patients come to us, like I said, we look at their background, look at any testing that has been done. The program consists of a consultation with Dr. Smith. Once he looks at what the issues are for the patient, we can set them up with a series of tests. And we've set the program up so that the testing can usually be done within maybe a 2-day time frame, so patients aren't drug out for weeks or months for their testing. The testing consists of looking at their esophagus to see how it functions. We look at how much acid actually refluxes into their esophagus. We can do an EGD on the patient to look at their esophagus, see if we see any signs of erosion. We can look to see if they have a hiatal hernia. We can also do a barium swallow, and again, that shows us how their anatomy is set up. It can show us of any reflux issues and hiatal hernias, again, that the patients can have. So those are just some of the standard tests that we can put the patients through. An EGD stands for esophagogastroduodenoscopy, and that's why we shorten it to EGD. Basically, it's a scope that goes in through the patient's mouth, through their esophagus, and down into their stomach. It gives us really an inside look at the patient. We can see if they have any erosions or ulcerations. We can see if there's any changes to the lining of their esophagus and their stomach, and it can show us if the patients have a hiatal hernia. It's a fairly quick procedure. It really only takes about maybe 5 or 10 minutes, and patients are sedated and asleep through the whole thing. We have a lot of resources that are available for our patients. Certainly there's the personnel. There's Dr. Smith, his nurse Barb, and myself. I'm the most easily accessible person, so people can contact me with any questions that they have. We also have our website available that provides some links to some resources that are available for patients. We also have patient videos that patients can watch. We have brochures that we can hand out for patients. So we also do seminars for patients. These provide patients an opportunity to talk with prior patients about their experiences. We have physicians there, including Dr. Smith, that talk about some options available to patients. It's a really good informational seminar for patients to attend. What sets our program apart from other centers in the area is we really are unique in what we can provide for patients. We provide them certainly treatment options that aren't offered in most other centers. We have condensed our program so that patients can pretty quickly get through the tests and be provided with their treatment options. We also provide patients with the Lynx device, which is one of the very few centers that offer the device, and we've had a lot of successful outcomes with that procedure. Teamwork that is provided by the center has been fantastic. We really are a tight-knit group. We know what the patients need. We're able to kind of anticipate when a patient comes in, maybe the testing they're going to need. We really have developed a good process for the patients where they don't fall through the cracks. Everything's scheduled in a timely fashion. Patients can call me and I know who I need to get in touch with, and they're very receptive of, oh, this is Kathy calling. We get things expedited. So it's a pretty tight process with the program and with communication with all of us.